Welcome to CrackTalk.
Hey everybody, how you doing? Dr. J here, and I got my boy Scott, and welcome to CrackTalk.
We are back.
We're back, and I'm telling you what, boy, did we have an episode for you. A little controversial maybe, but I'm excited about it.
Dude, when you came up with this idea, I have been so excited to do this because this is something that you and I talk about a lot.
Yes.
And it drives me crazy.
So we're gonna hit everybody over the head today.
Yes.
With the side effects of chiropractic. I want you to let that sink in. But before we do that, I know we're dripping content out once a week, making sure we're bringing the best we got for you, your family members, your friends, your coworkers, people that you thrive with, because I know you want them to first. What's our first thing? Get educated on how they can come out of their condition and live a better life. Second is get inspired that you don't have to be in pain or discomfort and have the kind of conditions we talk about. There are opportunities that you may or may not know about to help you thrust forward. And the last one are action steps to help move you through life that you can do. And we like to try to always say, bite-sized pieces or how the game is won. How do you eat an elephant? One little bite at a time. But before we get into that, make sure you're sharing the content. Make sure you're liking it, right, Scott?
Yes.
Make sure you put a comment and get this word out that CrackTalk is the place to go to watch Dr. J and Scott deliver unbelievable content that affects people's lives in a positive way.
Yes, and we cannot stress enough, if you know somebody, if there's a topic that we're covering and you know somebody that can use that information, please share it. That's what this is for, is to help educate you guys and then also give you content that you can share with others. I actually had an experience this week where I talked to some folks and I was telling them about CrackTalk, the podcast.
Love it.
And one shared the pregnancy. I got my, the chiropractor got me pregnant, and then the digestive issues. And
that's the one where Scott cried, just so everybody can reference back to that.
Do you realize every podcast we do, it's like, I had digestive issues. That's one where Scott cries.
I'm going to keep putting it out there. It's going to be the most watched CrackTalk.
I tell you, it's funny. I told this lady, I said the digestive issues, and she suffered with them. And I was like, hey, you've got to watch this. I said, it's my story. And I almost got emotional right there, telling her to go watch this one. I am so adamant about that. But that's what it's out here for, guys, is to please share this information.
And here it is. Make a comment. If there's some content that you, a family member, coworker, want to hear about, listen, we're more than happy to deep dive into it, dig into it, and once again, get some education pieces on this, get some inspiration pieces, and then really get some action steps that you can have for you and your family or whoever's suffering with the condition. Well, today, side effects of chiropractic. What are we talking about?
Let's get into it.
But before we get there, Scott, I always want to talk about most people don't know how many people are going to the chiropractor. I mean, it's always one of these things where it's a little elusive. It's like, hey, you got a chiropractor? Yeah, you got a chiropractor. Everybody heard Tom Brady's got a chiropractor, Jerry Rice, all these professional athletes, Tiger Woods, they travel with chiropractors. Chiropractors are now part of all the Olympic teams, which is coming up right now. So they're always there. They're always there, but it's mainstream, but I would still say still kind of kept under the rug a little bit. And I don't know why, because it's one of the most exciting things in my life is to be a chiropractor and present the message that we can turn the life on in your life by moving bones that are out of place, left, right, up or down, 1 to 5 millimeters. We call that a subluxation. Puts pressure on that nerve or affects that nerve or that joint that causes dysfunction on whatever is on the end of that nerve, whether it's a cell, tissue, and organ. And you can't have any function. And I always like to remind people, you can't have any function in your body, Scott, without your nervous system. Your nervous system orchestrates your cardiovascular system, your heart, the pump of your life, right? It organizes your breathing. It organizes that orchestra that you called, that got emotional about your digestive tract. It organizes the sex hormones we talked about in pre, post, and current pregnancy. So understand, that's what we're doing. So who's using chiropractic? Here it is. 10 plus percent of people in the United States go to a chiropractor. It used to be 5. It's now doubled in 2023. Now, what's that number? 35 million people go to the chiropractor on a regular basis, not just one visit, on a regular basis. If you're one of them, thank you for supporting our profession. And I hope you are seeing some of the side effects we're going to talk about today. No pun intended, but a little bit. 280 million chiropractic visits a year.
Wow. Wow. That's higher than what I thought, Jay. I thought it would be lower.
Astronomical number. Here it is too. I found out why women live longer and have a healthier existence. 6 out of 10 chiropractic visits are by women.
Mm-hmm. That does not surprise me. That's how I got into chiropractic. And I can't remember if I shared it or not, but my mother took me to the chiropractor when I was in 10th grade. So it's always been a part of our lives.
Yeah.
My mother always went. She's getting ready
Still goes.
Well, she's getting ready to turn 89.
Yeah.
And she says chiropractic, massage, and staying in shape and eating right are like the keys to living a long,
living
healthy life.
to 89.
She goes,
happy
you want the key to it? She goes, chiropractic, massage, exercise, and eating right. And
I
I'm
hope
like,
everybody gets that right there. So she's one of the 6 out of the 10 that have locked in. You know, women drive inside the family unit. You might want to check this microphone. They drive the health and wellness of the family. If any of you women are listening, you're the ones that are making the decisions whether the kids go to the doctor, whether the husband usually goes to the doctor. We see it all the time, Scott, inside the office that usually the woman comes in first.
Right.
Because they're dealing with, women are also more open to discussing their problems, right, which I love. And they usually lead then their husbands that are dealing with low back pain, leg pain, neck pain, or something that's debilitating their life, and they get them in. And then they also bring in their children once they find out, okay, kids need to be getting adjusted from as young babies. What do we always say? Cradle to grave is kind of the statement. So another stat, only 3.3% of the healthcare budget is allocated to chiropractic. That's how cheap it is. So you have 280 million visits a year, 35 million people are going to the chiropractor, and it only amasses 3.3% of the healthcare budget in the United States.
That's unreal.
Which goes into one of the side effects.
Right.
Okay?
Right.
Chiropractic. This is something I want everybody to listen to on this call. Chiropractic has been and is still the largest drugless medical intervention in the world, Scott. In the world. All right? If you go to a chiropractor, I want everybody to really lock these two numbers in too. Because if you've never thought about going to a chiropractor, you say, well, we're going to talk about some of the side effects, and this plays into our little spin on the deal, because we're always saying unrelated topics and we're spinning information. But here it is. If you are going to a chiropractor, Scott, did you know that you have a 60%? Now, these are statistics by the World Health Organization. Okay? So they're real. They're not just fabricated stats. 60% less likely to have a hospital visit.
Wow.
Check this out. If you're going to a chiropractor on a regular basis, you have an 85% reduction in your medication costs.
Jeez, oh Pete.
And usage. 60% less likely to go to the hospital, and 85% less likely to be on any pharmaceutical or incur those costs.
Wow.
So right there, I just gave you two side effects of going to the chiropractor. I didn't even mean to do it.
Yeah, think about that. 2 side effects. All right, repeat that. So
if you're under chiropractic care, you're 60% less likely to go to a hospital visit.
Okay.
All right, medical office visit. And then if you're under chiropractic care, you're going to have an 85% less likelihood to be on any pharmaceuticals, or an 85% reduction in any type of pharmaceutical benefit.
Wow. Wow.
So there it is, folks. I'm going to tell you what, we can almost wrap it up right there. And say it. But here's the first thing. The first thing that I want to talk about, the side effect that we talk about is, and what drives, because I also looked at what drives the majority of all of you and people into the chiropractic office. Well, Scott is our chief marketing officer, our CMO, and he knows that the message that is out there, yes, everybody loves wellness. Okay, everybody wants to live forever. Everybody loves anti-aging. We eat, sleep, or breathe this stuff. But what gets people to come into the chiropractic office is almost like what gets people to go to the medical office or their ER visits. One word: pain. All right. So one of the biggest side effects of chiropractic is people come in with pain, and then they start getting treatment. And over a couple weeks, the pain completely goes away or disappears. How many, raise your hand if you're at home right now or saying amen, that if you would appreciate that side effect. Please. You have pain, You go into chiropractic care, now you have less pain, diminished pain, or no pain, Scott.
Right. Please.
Do you like that side effect?
I love that side effect.
The other one that's in that kind of goes right along with it, which would be another side effect, is by getting chiropractic treatment on a regular basis, you're going to experience more mobility and more flexibility in all of your joints.
Right.
Especially the joints in your spine. And I want to really say, especially if you're going to a chiropractor who's doing a lot of what we call extremity adjusting, wrist, elbow, shoulder, hips, knee, ankle, feet.
Right.
You're going to experience the side effect of having increased mobility and flexibility and usage in those joints. Pretty cool.
That is, it goes right with the first one.
Yes.
The first side effect.
Yes. The other thing you're going to have, and we started this conversation today off with how important the nervous system is, Scott. You can't have anything. So they say there's some stats like if your heart stops pumping, you're able to live X amount of seconds. If you have like a laceration where all your blood's dumping out, you have an X amount of time where you can live. But let me tell you something. If your brain goes dead,
Done.
0 seconds.
Right.
So that just, and I'm not saying that we want that to happen, but I'm saying that's how important the brain, spinal cord, spinal nerves, central nervous system, and then your peripheral nervous system, all the spider web nerve roots that come off and the spider web to every cell, tissue, and organ, they're innervating every muscle, tissue, organ in your body. They're letting you know if you've gotten cut, if you've broken a bone, if you've dislocated a joint, or if you've hurt yourself, Scott.
Right.
They're also, the nervous system is what? Check engine light. Usually pain, which most people don't understand, that's why chiropractors are so good at addressing quote unquote pain, is because pain is a check engine light, for a lack of a better analogy, that when that light comes on, it's saying, hey, you have something going on that needs to be looked at. Possibly, Scott, needs to be repaired.
Well, and then I think we've talked about it before too, is when that check engine light comes on, that typically is the body's last ditch effort to tell you that something is wrong somewhere, correct?
And we still live in a culture, for a lack of better analogy, like we always used to do.
Yes.
My dad had these Lincoln Town cars and Cadillacs. Check engine light came on. It gets very annoying. Guess what? Black electrical tape, baby. You take the little electrical tape and you put it right over the check engine light. Hey, it's fixed. And I always say that's kind of like what is taking medication. You're not fixing anything.
It's black duct
mask
tape.
the symptom.
It's the duct tape. It is funny. Well, and then you get statements like, it'll go away.
Oh, it'll go away, all right. Usually when the car stops. And so that's what I always find is interesting about our profession and the medical profession. People usually wait until they're so far gone because they've been ignoring the check engine light. They've been ignoring the symptoms. They've been ignoring the alerts that, hey, you need to chill out. You need to have this checked out. And they keep going. And then all of a sudden, bam, something catastrophic happens. And now they're going to pay attention to it. But now we've taken something that could have been simple, cost effective to handle, and now we have a major situation. Like you don't take care of your low back in my life, you don't take care of your low back and get chiropractic care, once a week, every other week, making sure my disc, make sure my hips are aligned so my disc doesn't blow out. Let me tell you what's inevitably going to happen if I dismiss chiropractic care from my life. I will be on a table getting cut open, having surgery, a couple $100,000 surgery. So I'm going to spend the $50, $75, $100, whatever it is, not to spend the $100,000 to $200,000 because plus I just don't want the healing.
Well, think about it. Your check engine light comes on.
Yes.
In your car. And I love this analogy because it doesn't get better. It only gets worse.
Just because you put the tape on it doesn't mean
the longer we go, it gets worse to where it will stop at some point.
Yes.
So, and our bodies work the same way.
Scott, hey, think about this. When do most people have their car handled?
When it breaks down.
When it literally stops. I just had this will be documentation. I get in my truck this morning, I go to the gym, runs fine. I go to a meeting today after I come back to the counter, get showered, I go back out to the truck. Doesn't work. No check engine light on that one. That one just kind of hit me, fuel pump. But we're getting handled. But so what I find is now I've had to wait for something catastrophic to happen for me to go into massive action to get it to the place, to get the mechanic, to get it done. So you can't have your body function without proper innervation from your nervous system. So one of the side effects, another one of the chiropractic is this. You're going to have an increase in nerve flow. You're going to have an increase in your nervous system function, which if you look at it, nervous system function dictates health and wellness.
Right.
I'm going to tell you, being in this game for 20 plus years, you realize really quick with the stories we hear is the higher level your nervous system is functioning, the higher level your health and wellness is. And your mom knew this just because she experienced it at 89 years old, talking about chiropractic, massage, diet, right? And exercise.
Yes.
Imagine that. If we could just get everybody on this call, including myself and including you, just to live there, we would live happier, healthier lives. Okay, here it is. Next one. With a increase in nervous system function, you're going to have immediate increase in immune system function. So your immune system is completely innervated by your nervous system. And most people don't understand this, but study after study, you get adjusted your atlas, your first segment in your spine, right? There's no disc on that one. You get that segment adjusted, they've seen an immediate decrease in blood pressure after they did study after study after study. One of our doctors that works inside Core Health Centers was actually in the program where he was analyzing people's, I can't remember, systolic and diastolic rates pre-adjustment and then immediately post-adjustment along with their pulse. And they were blown away and actually got published at getting your atlas adjusted could immediately lower blood pressure. Well, if that's true, okay, right there, that parasympathetic nervous system that is regulating without you thinking about it, right? Unconsciously regulating, Scott, your heart rate, your breathing rate, your body's repairing, how many white blood cells, red blood cells, platelets, eosinophils, neutrophils, all these things. That's regulating, okay? It's also regulating your immune system, all those nerves right there. So what happens a lot is people come in, Scott, and they're having headaches, but they're also groggy. And then they get adjusted. Yes, we see an improvement with the headache quick, but then they're like, man, I'm not getting sick anymore. I usually get seasonal flu. I usually get a seasonal sinus infection.
Right.
But since I've been coming here, I don't understand the side effect of chiropractic is I have, it seems, an improved immune system. I'm just not getting sick like I was.
Yeah. Side effect. Don't get as sick as much.
Imagine that.
Boom.
How many, once again, I'm going to raise my hand.
Yes.
I would appreciate that side effect. I actually experienced that side effect. They actually did a really heavy study. It could be research if you want it. It was all about AIDS. And it was, they did a study of people with HIV, how they responded just to the medication. And then they did a test group with HIV receiving chiropractic and how they respond. I'm telling you, it is a jaw-dropping difference between the two test groups.
Well, think about when we came through COVID.
I wasn't going to mention COVID, but yet COVID,
You know, this is one
it
of
was
those things.
real.
It was
Yes.
real for us going through it, and then those coming back patients. You know, one of the ways to fight that too was I wanted to have, and people are like, how do I keep my immune system the strongest it can be? Because at that time, you know, when you had weaker, it was saying, you were hearing the reports, hey, if you got a weakened immune system, it would attack it.
Stay inside, wear the mask. Yes.
So it was one of those things that we had people come in and they became believers because it was like, hey, we are going to keep our immune systems at max capacity.
And Scott, I think that what you just said is an important question there. And I think everybody that's watching this Crack Talk needs to ask them this question. So if a weakened immune system makes you more susceptible to things and stuff out in the environment, COVID was one of them, right? How then, we need to all be asking ourselves, and this is the challenge that we would throw out to our patients, then how do you improve your immune capacity? How do you improve your rate of healing and function? Let me tell you what, chiropractic. It's a side effect.
Yeah.
All right?
It is a side effect of chiropractic.
There is no medication, I'm going to tell you right, this could be controversial. There's no medication that improves your ability to heal. There's no medication out there that is improving your immune system's function. There's only medications you take because you're immunocompromised, and then you take it so it can battle. But it doesn't improve. I think that's where I really want to get people to land today, is to understand that medications come in to substitute. They don't strengthen. Chiropractic, Scott, which is, I get excited about this if you can't tell. When you're getting adjusted, and you're getting adjusted in rhythm, and you're getting adjusted over long periods of time, you know, and I'm not talking about 4 times a week, one time, I'm talking about 1 time a month, you know, 1 time a week, every other week, whatever your life demand for you to stay unsubluxated so your nervous system is popping, right? You are going to live your greatest quality of life without sickness. I'm not saying you're never going to get sick. I'm just saying, if you do have something come in, you're going to be able to rapidly respond quicker. You're not going to be what I would call immunocompromised. You're going to be immunostrengthened.
Right.
Okay? So, go ahead. What
I was agreeing with everything you said.
Yeah.
Because just think about it. It's a very simple concept. We've touched on it every podcast that we do.
We have.
That nervous system working at full capacity, full functionality, 100%. That immune system is strong. It's robust. It's going to help keep you from getting sick, and then when you get sick, get over it faster.
You know, less missed work.
Hey,
Great
side effect.
100% side effect. All right. Next one, we already talked about it. Decrease use of medication.
Yes.
All right. WHO says 85% reduction in pharmaceutical use if you're under regular chiropractic care. Blows my mind. But we see it when you're in the chiropractic office, and I know a lot of you are not. We see this on a day in and day out. People are like, I was taking X.
Yes.
I was trickling Tylenol or Advil or Motrin down my throat. And now I don't. Little girls that are having, like my daughter, the only thing that's helping her, because she would take the Motrin or something like that for the menstrual stuff, and then we found that she just has to get adjusted the whole time through. And I will tell you, it's a little uncomfortable, because when you're getting this all is cramping and it's going through its cycle, the low back hurts, the legs hurt. Listen, I feel sorry for every woman that's going through it, but we found by getting adjusted through that process, and then after it, and then as it's coming on, we start getting her adjusted a little bit more frequently. Luckily, she lives with a chiropractor, Scott. So she's got the bennies.
There's that.
It helps her through it and has completely reduced the amount of anything she's had to take. So I want everybody to lock that in. Not only a 60% reduction in the possibility of going to the hospital, you're going to have an 85% reduction in medication use. And we're living in one of, I'll tell you, Scott, why I'm passionate about this.
I get real
Opioids
passionate.
Are destroying the planet. And it starts out, one of our Keeping Kentucky Healthy, which is on the back of these t-shirts, is this. Our Keeping Kentucky and Keeping West Virginia Healthy is our rally cry for unintentional drug abusers. I want to hit that once again, because I think sometimes it gets missed. We're fighting this fight, Scott, where normal people like you and I, low back, your shoulder, your hip, you go in, you get surgery, you go in the medical office, they give you Percocet, Darvocet, they give you opioid, they give you the oxycodone, which is, they call it the devil's drug because it's so effective at killing any type of pain. But let me tell you something, you're on it too long, bam, you're an addict. Then what happens is people are on these drugs too long, Scott.
Right.
And then they become an addict. And usually it's a 3 to 5 year cycle. They're on it, they're able to hold the taper like we always say, they're white knuckling it. And then the doctor starts writing it, or stops writing the script, and then they got to go to the street, or they got to go somewhere else to get it. And unfortunately, usually about 5 years into that heavy process, they then end up at black tar heroin. And unintentional. I never would have intended that anybody I know would be there. Great people.
Right.
Figures of our society. People that we look up to, successful people, end up there because of the current system. So we're fighting it. You know, I want that to be 100% reduction. When you come into the chiropractic, I don't think it ever will. But we want the side effect to be like, when you come in here, you start functioning so well and your body is so rapidly healing that you go off all your medications if possible. Right? But you got to check with your doctor to make sure that's something you can live with.
Right.
We already had this. Last podcast, Scott, was about sleep. Let me tell you something. Getting chiropractic adjustments is 100% going to lead to a side effect. You're going to get better sleep.
Better sleep.
You've experienced it.
I've experienced it. We talked about it in the sleep podcast.
It's our last Crack Talk.
We get that a lot of patients when they come in, and it is one of those. They come in for a shoulder pain or something like that, and the added side effect of chiropractic care is they will come back in within their second, third visit and be like, man, I am sleeping like crazy. This is amazing. What's going on? And it's like, oh, well, Was it side effect number one? You're naturally getting out of pain. You have increased mobility. You know, all this starts.
Your body's functioning better.
It's working the way it's supposed to.
Yeah.
So guess what? Your body says we can rest.
And Scott, we talked about it in our podcast. Rest and recovery are one of the most important things us as humans. We are living on this planet in a state of chronic, toxic stress. I don't know if you've figured out how to live in a bubble. I have not. I don't think any of you have. If you've done it, put it in the chat because we'd love to see how you did it. But let me tell you what, people are so sleep compromised. We talked about the amount of medication, the amount of office visits, the amount of ancillary products on this world for people to quote unquote sleep better.
Yes.
It's real. And we do see what Scott just said so much, man. Is it like, hey, I'm in my second or third visit. I'm sleeping like a baby. What is that about? It's like, hey, we're just bringing function back to your body.
Yeah.
And my shoulder's healing faster. See, when you sleep well, you recover well.
Yes. It's that vicious cycle.
If you don't sleep well, I'm going to tell you what, you're going to be recovery intolerant.
Well, think about it. When we do exercises, most of these guys that are trainers, things like that you watch, one of the biggest things they say is, hey, you can go to the gym, you can eat right, all this stuff, but if you're not getting quality sleep, guess what? It's an uphill battle.
I've heard this so many times because, you know, everybody's always giving you crap, like these big old arms right here. But are you overtraining? There's no such thing as overtraining. I will tell you what, there's under recovery.
Right.
If you don't give your body, so you could train like heck, man, and put it on your body. That's the cool thing about being human.
Yes.
It can build strong muscles. It can build strong joints. It can build strength inside of you. And I hope that's one of the pieces that are inspiring today is you can have strength inside your body to defeat the chronic stress that we live on a daily basis. But you've got to give your body the opportunity to heal, which sleep, I'm going to tell you, we could go long ball, which we did last time.
We've done it.
Sleep equals recovery.
Yes.
Lack of sleep equals you're now recovery compromised.
Right.
And you've got to find a way to figure out sleep. Watch the last Crack Talk on our action steps in and around that. But what a blissful side effect.
Oh.
I get adjusted.
Yeah.
I go to the chiro and I sleep better.
Well, think about what we've done, and actually I'm just looking, I'm cheating. I'm looking down at the last one, which you just touched
Goes right
on.
into it.
And it is like, how do you get better sleep? I don't know, less stress?
Yes. Or stress, I would say you can't have less stress, but your body needs to feel less stress. And when you're in a subluxated state, Scott, and your nervous system is not functioning properly and it's not doing what it's supposed to do, you're going to go into anxiety.
Yes.
Your body's going to go into fight or flight.
Well, and you kind of get stuck there.
You get stuck really
stuck
quick
in that fight or flight stage, and that is something that personally I've been coming in, getting adjusted, and doing the upper cervical adjustments and things. And I tell you what, Jay, I can get that adjusted, and it almost feels like that stress. It almost feels like it washes
like
off.
a veil.
It is like somebody just went, whoa. You know, you see the curtains drop.
By the way, this is a very common experience inside the chiropractic office. People get their neck adjusted after they kind of get over the entire fear of it. They get adjusted and they lay on the table like, give me a minute. And it's like a veil comes over you of peace. Of comfort. It's like you can't explain it to somebody unless you felt it.
Yeah, so if you've never experienced or never been to a chiropractor, it's one of those things we can try like crazy to explain what this is.
100.
But it is the most amazing thing. It is my favorite thing in the world because you instantly, there's been times I've had adjustments and I'm almost like, you know,
like almost
you can
pass out on
fall
the table.
asleep on that table because your body is in such a fight or flight state that when it releases, your body just, you almost feel like you collapse.
I will tell you, a lot of people will get adjusted, Scott, and they'll have so much stress built up in their spine that they almost will feel nauseous.
Yes.
And that's another thing to be, they'll cry. Sometimes when we adjust people, you talk about stress. Stress is freaking real, and your body has an ability to grab stress and we're going to park it in this muscle, and we're going to park it in this neck, or we're going to park it here. And then all of a sudden you get adjusted, your body turns on and says, we got to fix this area. We've been storing the stress. So then all of a sudden you get this release of lactic acid, or just, we call it poison. Your body just releases that stress and poison in your body. You can get nauseous. Now what's cool is your body knows you released it, so you get it out of your system fast.
You hit something that is so important to me, is when that stress, it can park it anywhere in your body.
It will. It's how we work.
Oh, and that is something that I think people really need to understand. You can park it anywhere. So then when you get that adjustment, it releases. It is magical. It's
so what a side effect. Stress reduction.
Yeah.
When you get adjusted, you are going to immediately feel that veil across your body where your body starts to then release those compartmentalized stressful pockets. We call them poison, like I mentioned in the office. So the good thing is it heals quickly. Now, look, who would not want to go, like you were saying, if you saw a commercial on TV and it says, man, by going and getting chiropractic care, you're going to get pain relief. You're going to get increased flexibility, mobility. You're going to get a boost in your immune system. You're going to not be relying on any type of medications. You're going to not have to go to the doctor. You're going to get better sleep, and you're going to reduce the amount of stress and your ability to manage stress in your life. Wouldn't you line up for that?
Why are people not lining up? Instead, we get all the things that can go wrong. You know, all this stuff.
Diarrhea, you take this medication, and while she's riding the horse, you're going to get diarrhea, ED, you're going to get constipation, you're going to get, I mean, you name it. Mm-hmm. And I'm like, why would somebody take that medication to get off that?
Right.
To have all of these. So what we're trying to just impress people, look, once again, we've educated you.
Well, yeah.
Go ahead.
I'd say, so if you're taking that medication, it's not saying that if you're on it.
Yes.
That, you know, that's it. But the action step that we can give out this week is if you're on this medication.
Yes. Or if you're in pain,
yes.
If you have any of these, the opposite of this, reduce, you're immunocompromised, you're not dealing with stress well, you're not sleeping well.
You're getting sick a lot, you're up at night.
You're taking more and more medications to thrive.
Right.
First thing we always tell people, get a referral for a chiropractor in your local community that can put hands on you and start helping you get your body back out of subluxation into a stable state. Right, Scott? Go get your spine checked, which is you always say. First thing is don't even worry about getting adjusted. First, go to the chiro, get your spine checked, get x-rays, do orthoneurals, let the chiropractor tell you what they see and what they can help you with, and then get the help.
Imagine if you go in and you have a chiro take a look at you, and there's a subluxation you see the nervous system coming down, there's a subluxation of that vertebrae where that nerve is going to that part of the body. And all of a sudden you're going, wait a minute.
It happens quick.
There is interruption in communication from my brain to my pancreas, so therefore I'm having sugar issues or diabetic issues. Yes. It is like, are you serious? It's like, why are people not lining up to get this done first? It's always
just don't know.
Should be the first line of attack. That is like my rally
Just
cry.
don't know. Just don't know. And I'm telling you, this is why chiropractic has become and is still the number one drug list medical provider in the world, is because what we do is so effective of addressing subluxation bones out of place. And when we put those bones into place, bam, magic happens. So I hope everybody, you got some freaking education today on the side effects of chiropractic. Pain relief, mobility increase, nervous system function, boosted immunity, decreased dependence on medication, better sleep, and stress reduction. I want that for each and every one of you. So does Scott. Let's go get it. Get inspired, which is the next thing, that you don't have to live in the pain, the discomfort, or the condition that you are in, and then take an action step. Go see a local chiropractor, get your spine checked, and see if the miracle of chiropractic can bless you, your family members, your coworkers, because we want everybody. Scott, would you agree? 100%. How do you make a happier, healthier planet? It's by one person at a time, walking through life, improving their way.
Yes.
And excited about it.
Oh, yes.
So there you go. That's our Crack Talk, side effects of chiropractic.
I love it. Hey, if you guys like this, remember, like it, share it, leave a comment for us. And again, I'll say it again, share it. If you know somebody that has thought about chiropractic or something like that you know, please share this information with them and let us know. You guys let us know what you think about what we're doing. If it's good, bad, otherwise, let us know.
There you go. And I want everybody to experience these side effects of chiropractic. So
please,
welcome to the next episode of Crack Talk. We'll see you next week. You guys have a great one.
See you guys.